Okay, you should be good to go.
Okay, thanks. So, thank you everyone for joining this webinar. This is the quarterly webinar of AGO GeoHealth, and today we are having it on the applications of satellite remote sensings to study and manage infectious diseases. Before we start and get into all the talks, let me give a brief introduction. My name is Moises Mani. I believe like most of you don't know me. I'll be the moderator for this webinar, and this webinar was organized by Dr. Azhar Abadi, and I'm just filling in for her. Thanks to her for organizing this webinar, and today we have a very distinguished panel to discuss the different areas on the application of remote sensing to manage infectious diseases. So we have four panelists. Each panelist will get like 10 minutes, and then we'll have the last 20 minutes for open Q&A. If you have any questions, you can post in the chat. The first panelist we have is Dr. Carl Mallings. He's an assistant research scientist at Morgan State University and at NASA Goddard Space Flight Center. And he will talk about the use of satellite-based remote sensing data in the health application. The second panelist we have is Dr. Elizabeth Bradley. She's a research scientist at University of Alabama in Huntsville and National Space Science and Technology Center. And she will provide us some insight on the use of NASA's Earth observation in the domain of vector-borne diseases under the bigger umbrella of One Health. Our third panelist is Dr. Tatiana Loboda. She is a professor and chair in the Department of Geographical Sciences at the University of Maryland. And she'll discuss how Earth observation data contributes in assessing risk of vector-borne infectious diseases. And the last panelist for today is Dr. Michael Wimberly. Somehow got stuck. Dr. Michael Wimberly, he's a professor in the Department of Geography and Environmental Sustainability at University of Oklahoma. And he'll discuss several applications where remote sensing data was used for forecasting and risk mapping of mosquito-borne diseases. So now I'll hand it over to Dr. Cal Mallings, and he'll take forward from here.
All right. Thank you very much for that introduction, and welcome everyone. So I'm going to start off the panel. Get presenter mode started. Okay, I'm going to start this panel off with a bit of a brief introduction and overview of NASA's efforts to enable satellite remote sensing for health and air quality applications. So as I'm sure many of you are aware, NASA has a fleet of Earth-observing satellites circling the Earth and collecting measurements. Various satellites use various instruments to collect data with different spatial and temporal resolutions. And these data are collected to tell us about the Earth system and various aspects, including some examples here: land surface temperature, rainfall, humidity, soil moisture, vegetation, wildfire occurrences, aerosol optical depth and aerosol size distribution, so the presence and the concentration of different types of particles in the atmosphere. And all of these different data sets, many of them either have a direct or an indirect effect on human, animal, and environmental health, including through effects on air quality, which is my particular focus. This webinar is more focused on infectious diseases, but just to set the stage, I'm going to talk broadly about health and air quality combined and give some particular examples from my experience with, which is more in the air quality domain. One of those concrete examples here is the data from the TEMPO mission. This was a mission launched last year aimed at collecting hourly data on atmospheric trace gases, including gases relevant for air pollution over North America, including the US, Canada, and Mexico. And as you can see in the animation here, this sensor is providing hourly measurements across these areas. And this really allows us to track the changes in air quality due to things like nitrogen dioxide, which is what's being shown here, over the course of the day in this domain. So nitrogen dioxide is a gas emitted mainly by industrial activities and the burning of fossil fuels. And you can see the hot spots in this concentration around major cities and also along the major transportation corridors and highways. connecting those cities. And you can also see how the different levels of contribution of these trace gases vary throughout the day. So this is really a new capability that this instrument's providing us. And this is just one example of the kinds of data sets that are provided by NASA and relevant for health and air quality. So let's just move to the next slide. And that leads us into a discussion of the NASA Earth Science to Action strategy. So what this is basically the idea that NASA wants their data to be used and to apply to improve the lives of people around the world. And this strategy is organized according to a couple of different theme areas, which are shown on the slide here. One of those theme areas, as you can see at the bottom, is health and air quality, which is what I'm going to be focusing on today. So just to zoom into that, the NASA Health and Air Quality Applied Science Program is a program within NASA headquarters, which is aimed at supporting the use of Earth observations for air quality management and for public health. And some of their focus areas include the use of these data to look at infectious diseases and environmental health, which is our topic of discussion of the webinar today, toxic and pathogenic exposures, air quality standards, policy and regulation, and also the effects that climate change is likely to have on public health and air quality. And the Health and Air Quality Applications Program area supports this activity in a couple of different ways. One of the ways is providing direct funding to researchers, which are applying Earth observation data, remote sensing data across these different domains. I'm actually involved in one of the projects, so just to give you a sense of what these projects might look like, this is the particular project that I'm working on, where the goal is to combine global resources from NASA, including model data, satellite remote sensing data from NASA and from other agencies operating satellites, and bring that together with local air quality information collected by air quality monitors operated by regulatory agencies on the ground. And by combining these data sets together using the Google Earth Engine in this case, we aim to produce high spatial and temporal resolution estimates and forecasts of the near surface concentrations of key pollutants, which can then inform policymaking and decision making at city level about how to manage and how to eventually improve the air quality and the resulting human health outcomes due to improved air quality. And this is just an example of a screenshot of a web portal we're developing through this project for Rio de Janeiro, specifically in this case, looking at the outputs of this process where we've combined the model, the satellite, and the ground-based monitoring data to map air quality over the domain and also look at how that air quality changes over the course of several days. So this is just an example of the kind of project where we're bringing together NASA resources with other local resources to investigate air quality and its impacts on human health and eventually lead to decisions and actions to improve those outcomes. Another element of this Earth Science to Action strategy, which is in the top row here, is capacity building. So the basic idea here is to enable other people to use NASA resources and NASA data sets, not necessarily through providing them with direct funding, but providing them with some guidance and some tools to use these data and access them and use them for their own purposes. So one of the elements of that capacity building objective is the NASA Applied Remote Sensing Training Program, or the RSET program. The goal of this program is to provide cost-free, both online and in-person trainings to people who are interested in applying satellite data in different application areas organized according to a number of themes, which you can see on the right. And again, one of those themes is health and air quality. So applications of satellite data to health and to air quality. I'm also involved as well in the RSET program as one of the trainers within the health and air quality applications area. So in these trainings, we aim to provide information to address some basic questions people might have about how to use remote sensing data in these different applications. And I've tried to organize them according to a couple different broad categories shown here. So the first object here is a basic level question: what can be done with the data? So how is remote sensing data on temperature and humidity relevant to what I'm looking at, for example, in infectious diseases? So the idea there is we usually present application examples and case studies. We walk through case studies. We bring some experts on board who have done this type of work in the past to explain their approach. And this kind of gives a sense of what can be accomplished or what has been accomplished in the past using remote sensing data for these applications. Another broad question, what kinds of data are available? So this usually involves walking through some of the missions and the commonly used data products produced by those missions and their strengths and limitations in different application areas. Another more practical question, how do I find the data? How do I access the data? This usually involves walking through different data portals, more recently talking about how to access the data remotely using cloud resources or using application programming interfaces, APIs, to query the data sets. Another practical question, how do I manipulate or interpret the data? We usually try to answer this by providing example codes and walking through these through hands-on exercises where people go through the process of opening a data file, for example, extracting particular pieces of information from that data file, creating plots with that data, and so forth. And then finally, we get commonly asked questions about how do I integrate remote sensing with other data sets? And we try to address this through, again, providing examples of applications. And with a particular focus on health impacts and human factors data, often those data sets are available in very different formats, very different spatial and temporal resolutions as compared to the satellite remote sensing or model data sets. So bringing those two disparate types of data sets into a common format is a big technical hurdle for many people seeking to apply this data, and it's something that we seek to address through our trainings as well. So all that brings me to my ulterior motive for being on the panel today, which is that through the RSET program, we're thinking about developing a course on remote sensing applications for climate-sensitive infectious diseases. So as the rest of the presenters are giving you their presentations today, I'd like you to keep in mind some basic questions about how you might think about applying remote sensing data in your work, similar to the work they've done or inspired by the work that they've done. And then to do that, what kinds of information or instruction might be useful to you? What kind of capabilities might you need access to that you don't already have access to and you're not sure where to find those? All that kind of information would help us sort of design this training. And to collect that from you, I have a survey which I've created. I'll put the link in the chat after I'm done speaking here. But we'd like to, again, get your feedback on some of these ideas to kind of inform how we design this course and what types of things we focus on in it. So with that, thank you very much for your attention, and we'll pass it on to the other presenters.
Thank you, Dr. Emeling. And now we'll move to Dr. Bradley. And thank you so much for being on time.
Hi. Let me work to share my screen real quick. Right, so I'd like to highlight some of the opportunities for Earth observations to inform field-based ecological research necessary for a One Health approach to disease control. For some context, some of my past research was on the impacts of invasive wild pigs, water quality in wetland ecosystems, and the resulting implications for the risk of pathogen transmission. So much of our current understanding of the relationships between ecosystems and disease are centered on how the characteristics of an ecosystem influences or facilitates presence and transmission of a pathogen. In many ways, this can be summarized by how the environment supports the vectors and host of a pathogen, as well as how the environment supports the persistence of the pathogen within the environment itself. There are a lot of ways that Earth observations can support this, including in helping researchers identify areas that provide suitable conditions for both the vector host species and the pathogen itself. I'd like to quickly go through a few of those before giving an example of how Earth observations are being used in practice to inform vector control efforts. So temporal dynamics that strongly influence vector-borne disease can be identified or monitored using Earth observations. Three examples are seasonality, succession, and disturbance. Seasons influence host susceptibility, transmission, and environmental persistence. Host susceptibility to infection may be greatest within winter when immune response is decreased. Community contact is increased, whereas summer may facilitate the greatest environmental persistence of some pathogens due to the increased warmth, wetness, and nutritional availability. Succession is another temporal dynamic that can be identified and monitored remotely. Successional stages are strongly associated with the abundance of vector species and the occurrence of pathogens. This can be especially beneficial when studying environmental dynamics associated with tick and mosquito-borne disease. However, it may also become instrumental in studies evaluating persistence of the pathogen, as well as transmission to humans. The disturbances influence essentially all of the dynamics described in the next slides. Due to the complexity of the influence of disturbance and its compounding nature, it can be most helpful when measuring its impacts over time, which can be measured remotely in a multitude of ways, especially through the use of satellite-captured Earth observations. When discussing biomass and energy fluxes, most research focuses on the influence of pathogens on the occurrence and abundance and health of host and vector species. The findings of this research provide valuable tools on identifying where the control efforts should be focused. A good example of this is how the positive relationship of vegetative biomass and productivity, um, along with the negative relationship of vegetative diversity, influences the abundance of arthropod vector species like ticks. And so when you're looking at a system that's shifting over time to having greater vegetative biomass and productivity, along with like a reduction in the diversity, so through transitioning to a monotypic stand, for example, that could have like huge implications on the abundance of arthropod vector species and therefore the risk of disease. And so when you're monitoring that remotely, that can really inform where you need to direct efforts. However, there's a lot left to be studied about the characteristics of pathogens and how they influence the ecosystem itself. And this is a great example of how Earth observations can support such research. This includes questions like how does the presence of the pathogen influence the community of terrestrial and aquatic biota? We know that invasions of zoonotic pathogens can strongly influence the overall biotic community. And so is this something that can be measured at large? These are a lot of the kind of questions that we'd like to have answered. Does it influence the function of host or vector species in the ecosystem? Does their reduced health influence productivity of the system? Are these like really reliant on some of the vegetative components we're noticing? How do resource use compare between infected and non-infected individuals? Does this have a compounding influence on the biotic communities? Biogeochemical characteristics of an ecosystem are the driver behind the distribution, abundance, and environmental persistence of pathogens themselves. This influence of the environment also, therefore, like influences the virulence of pathogens through a multitude of really interesting methods, including competition, predation, horizontal gene transfer, formation of biofilms, and that's just describing bacteria alone. And so the capacity to regulate their genes in response of their surroundings and through bacterial communication results in activation of genes related to nutrient processing. It's in this way that an invasion of a zoonotic pathogen could potentially have a very strong influence on the biogeochemistry of an ecosystem. And this could result in large cascading impacts that might be measurable from satellite observations. And so a lot of other questions include like how significantly does the invasion and presence of a zoonotic pathogen influence the communities of terrestrial and aquatic microbiota? We see the influence of biofilms in estuaries and marine environments, but this can also influence forests as well. But to what significance level? Like how big of an impact are they doing? How do they compare in terms of resource use? What consequences does it have on overall nutrient cycling and the productivity of an ecosystem? And does this in turn influence disease risk? Does it create better conditions for vector species? Or are these increases in productivity something that's going to encourage more human interaction with that ecosystem and therefore an increased risk of transmission events? So there's like a lot of research that's needed, and Earth observations really give us a powerful tool for directing that research. An example of this in practice is how wild boar and Earth observations are used for monitoring wild boar and disease. So you think it's going to be something very simple, like just habitat identification, but that involves a lot of complexity, including like proximity to water, proximity to ag fields, the amount of cover and food availability. Does this put them in increased conflict with other animal species? For example. And so then Earth observations also are used for risk mapping. And so you would look at things like livestock production, landscape connectivity, proximity to suitable habitat, relative boar population and abundance. And so you would really rely very strongly on Earth observations to conduct a lot of this. And then this then informs a lot of the wildlife management efforts. So exclosure fencing, You'd use the Earth observations to direct where that needs to be built and maintained, and can potentially be used to monitor the effectiveness of it. It's also the direction of preventative management efforts, such as density reduction through hunting policy or through active culls of that population. And so then this is also useful. Earth observations can be like really essential in outbreak response. So the identification of carcasses in large quantities, regulatory compliance, such as like in Germany with wild boar and African swine fever, there are bans on harvest of certain crops, for example, corn. And that's in order to prevent the spread of disease. And so you could like very quickly using Earth observations, check to see whether or not farmers are complying with these regulations. And then therefore go out and provide extra assistance with the disease response. And as well as population culling. Sometimes you can see, like out in Texas, very large populations of wild boar that are identifiable from like airborne flights. So not quite satellite Earth observations, but certainly with directed flights and um, unassisted aerial vehicles. But yeah, that'll be it for me.
Thank you so much, Dr. Bradley. This was really interesting. If anyone has any questions for Dr. Bradley or Dr. Mallings, please put in the chat and we'll come back to those questions by the end of this webinar, like in the last 15 minutes of this webinar. And now we'll move to our next panelist, Dr. Loboda. Doctor, whenever you're ready.
Thank you so much. I hope you can see my screen, which is about to get more exciting. Thank you for being here. So my topic today is focused on injecting Earth observations into understanding malaria outbreak dynamics in Myanmar. It's a fairly large group of people that have participated in developing this work. And again, my goal is not so much talk about malaria and the outcomes of this effort, but talk about what we're doing in terms of incorporating Earth observations into making this possible. Very upfront, the funding acknowledgement come from the NASA Applied Sciences Health and Air Quality Applications funding, but also a lot of additional funding from NIH, NASA LC-LIC, and Gates Foundation. So malaria is a horrible disease, right? We have about 250 million cases in 2022, and they are on the rise, over 600,000 deaths. We are not anywhere close to meeting the milestone for the global malaria elimination. And there are very many reasons for that. So we really need help to develop these models that help us identify and support malaria elimination globally. Our work focuses on Myanmar, a country in the Southeast Asia. And I find it very, very helpful to frame development of the model within the conceptual framework of risk. What does risk actually consist of? So we adopted the IPCC definition of risk framework, which takes risk as an intersection of hazard, exposure, and vulnerability. And I find it particularly helpful because if you don't think through all three pedals, you're going to miss a substantial component of risk and then be surprised that your model is not performing really well. So in terms of malaria, what does risk mean? It's a fairly straightforward composition here. So again, keep in mind that what I'm talking about is risk in terms of not just malaria risk, but how we inject satellite observations in it. So the hazard really answers the question, where does malaria come from? And that comes from two components. You have parasites and you have vectors. There's nothing we can do with satellite observations for parasites. We need medical scientists on the ground to tell us where the parasites are, but we can do a lot for vectors, right? And the vectors is Anopheles mosquitoes, and we can characterize the suitability and availability of their habitat and the conditions that enhance the transmission of the virus. So exposure, however, really deals primarily with people and as well as vulnerability. It is the people who determine what the exposure is and what the vulnerability is. So exposure, can you see it? Because there, is that better? Okay. So the exposure really answers the questions, how do people get exposed to malaria parasites? And that, for Myanmar, boils down to two things. How do they live? Do they live in um, buildings that are open to the air, have fairly low barrier for the mosquito penetration? Or do they live in concrete houses with air conditioning systems? That's two big differences. And what do they do? How much are they exposed to malaria through their daily occupation on chores? Vulnerability is slightly different. It really focuses on why are some people are more likely to get sick, right? And that question frequently has nothing to do with remote sensing. For example, immunosuppression through pregnancy makes pregnant women more susceptible to malaria. Nothing we can do with satellite observations there. But what we can address is, why is it harder to get treatment? So the access to care. So in that sense, we transform this risk model into our malaria burden potential variable, which we evaluate through this hazard exposure vulnerability. And when we're looking for hazard, we start with developing the very basic land cover land use maps that help us to both identify mosquito habitat and the habitat quality, as well as characterize what people do on the landscape, so partially address the exposure component. There are lots of marvelous satellite observations that support vector habitat monitoring. We have vegetation stress data, we have temperature both daytime and nighttime that actually assists in understanding both how the mosquitoes are doing, but also how well the parasite transmission is happening at different situation in different environmental conditions. Despite the fact that we have so much satellite data, it is very time and effort intensive to process it because, for example, in Myanmar, we have monsoon seasons, which means extensive and persistent cloud cover, which means a lot of gaps in observations. Here is an example for land surface temperature. The first on the left is the graph that just gives you what's available. The red on the middle graph highlights just how much data is missing at the daily observations, at the 8-day composites. And then we have to develop fairly sophisticated algorithms to gap fill those values to create consistent record. And then we able to get these beautiful maps that have no gaps in their observations, but it's not very straightforward. It's not easy, right? There's a lot of work that comes from remote sensing analysis that goes into developing these data sets. We do a very similar thing for NDVI. Once the cloud cover establishes, you can't see the surface. So a lot of effort goes into gap filling and predicting NDVI values moving forward. So in terms of exposure, we're looking at two components. So we're looking at population distribution and we're looking at occupational exposure. In some areas of the world, such as Myanmar, the data on population distribution is incredibly spotty. There are no good data sets. So we were essentially, we needed to create the data sets that show us where currently the population is distributed, and then using established procedures, you use the sensor data, Myanmar census data to distribute the population across landscape. So we developed a data set which has a much more precise identification of where the population is and what kind of living situations they have through this project. And then we were able to distribute the actual density where most of the people live and then transform it into the population availability. Land use is a good proxy for occupational exposure. And there's a lot of work that goes in the background to assign these exposure categories to different components of land use. But you can transform, again, satellite observations of land surface into a proxy for occupational exposure, shown on the right. And finally, vulnerability. We really looked at two components. There was a wonderful assessment that was done by the UN of social vulnerability in Myanmar, and we were able to ingest it in this model. But what we spent a lot of work in our project doing is figuring out access to care. Again, when you have very limited understanding of where existing roads are, we spent a lot of times in those least accessible areas across the country, digitizing road networks, and we contributed an incredible amount, and therefore were able to get a much better understanding of what the actual access to care is. So once you put all of that together, you can create a wall-to-wall 8-day repeat frequency observations models of malaria burden potential across the entire country in Myanmar. And that's where I'm going to stop, and we'll take questions later. So thank you.
Thank you so much, Dr. Lubada. And that was really interesting. You provided all the steps to develop the model and you brought up the limitations and how you dealt with it. Thank you so much. And if you have any questions for Dr. Lubada, please put in the chat and we'll discuss after Dr. Wimberly's talk. Dr. Wimberly, it's floor is yours now.
Can you hear me now? All right, can you see my screen? Is that a yes?
Yes.
Yes.
Okay. All right, I'm just gonna dive, in the interest of time, I'm gonna just dive right in. Let's try to get this out. Okay, I'm gonna start, what I'm gonna do is just quickly go through a few high-level examples of applications of satellite remote sensing for mosquito-borne diseases, particularly looking at effects of climate and urbanization. I'm going to start with a chart from a paper that I did a few years ago, and Tatiana was on this as well. And this is just kind of an overview, looking at the gray boxes across the top. You know, these are the sorts of things that we measure directly with satellite remote sensing. And then these translate into groups of risk factors that affect mosquitoes and mosquito-borne disease transmission. The climate, sometimes we can get direct measurements of habitat. Other times broader looks at land use that tell us, as Tatiana nicely pointed out, something about human populations and their exposure and vulnerability. And these all kind of filter through and influence the mosquitoes and parasites in various ways. So this kind of just sets the stage. And what many of us are trying to do in different ways are leverage these relationships to predict malaria outbreaks. So, in Ethiopia, as in other parts of the world, our progress toward malaria elimination has slowed and in many cases reversed in recent years. So there's a real desire for new tools to shift malaria surveillance from more of a reactive approach, looking in the rearview mirror, to a predictive approach. So using these relationships, we can draw on different types of Earth observations, land surface temperature, precipitation estimates, our old standbys, vegetation greenness, and other spectral indices. There are a couple of examples here. And, when we analyze these relationships using different types of time series models, we often find that, there are relationships. So we can leverage kind of advanced methods like distributed lags that will look through these large databases and highlight what are typically lagged effects of temperature and precipitation. One interesting thing to point out here is that there are often specific places where this works and where it doesn't. So in this case, in the Amhara region of Ethiopia, these two clusters, C and D, that are highlighted here, these are places that are actually very outbreak prone, and we find sensitivity to temperature and precipitation. In other cases, like lowland areas with more endemic malaria, highland areas with very low transmission levels, we don't see a strong relationship. So there are particular places where we have this opportunity. To be able to actually use these types of models in public health, we need to do a little bit of more work. And again, this is something that Tatiana alluded to in her presentation. There's actually a lot of underlying work acquiring and processing and integrating the data, and then running the models, converting the outputs into something, into a form that the public health professionals can actually use. So we have put a lot of work into designing software systems to actually implement these types of predictive models using remotely sensed data. So, this, I'm not going to go through all the details, but, key steps involve, actually setting up and parameterizing the models. Also, actually implementing them on a weekly basis, and then having some kind of built-in functions to actually validate the models so we know how well they're working. And, so this system that we developed produces things like alert maps. So taking the remote sensing data, taking malaria surveillance data, and we can see on a weekly basis estimates of both early detection, so looking at recent case data to see where it's exceeding a threshold, and then the early warning alerts, which are projections forward up to 12 weeks based on recent environmental anomalies detected with satellites. And if you look over on the right for one of our districts, we can see a forecasting chart. So if you look in the middle, looking to the left, that's historical data on malaria cases and environmental variables. And then we have predictions going over into the future on the right. So again, this is kind of the point of developing the software, is to take the data and then be able to use it and translate it into something that's usable by public health professionals. I'll just point out quickly that this can be done for other types of mosquito-borne diseases as well. With the support of NASA Health and Air Quality Program, we developed the ArboMap system. So this is a system for forecasting West Nile virus outbreaks in the United States. We've done this in collaboration with multiple state departments of health: South Dakota, Louisiana, Michigan, Oklahoma now. And again, as with epidemia, really part of the challenge here is coming up with a tool that can automate a lot of these steps so that someone working in a public health office can, generate forecasts and interpret and use them without having to get into a lot of the low-level details of the data manipulation and modeling. And I've mentioned validation before. So an important aspect when you do this type of work, and something that people will always ask you, is, do the models work? Are they accurate? So, part of the process is developing frameworks for actually testing the models. So, in this case, this is West Nile virus in South Dakota. We can look at the historical fit to the, to the seasonal curves of West Nile virus transmission. And then we can actually try to do forecasts outside of the range of our calibration data to see if this works. And in this case, we were able to show that the forecast evolved and improved as we get more input data over the course of a West Nile season, and that still pretty early in the season, we can distinguish between low transmission years and high transmission years and provide forecasts that are actually useful for organizations that are doing disease prevention and mosquito control. All right, one last thing that I want to mention is that when we do this work, a lot of times when we're working with weather or climate data, it's derived from weather stations, either individual weather stations, meteorological grids. One of the challenges is that those meteorological stations are typically not the places where mosquitoes hang out and where people are getting infected with mosquito-borne diseases. That might be in, a backyard para-urban environment. And when we look across cities, we have a lot of factors that are creating strong variation in temperature and other meteorological variables. So, a question is this microclimate variation actually important when we think about climate and mosquito-borne diseases? So we did with some colleagues who were then at the University of Georgia, we did a study a couple of years ago where we leveraged satellite remote sensing to take these coarse scale meteorological grids and then downscale them. So, minimum temperature at night, we see an urban heat island effect, whereas during the day, we see variation more related to vegetation, particularly tree cover. And then we combine this with an epidemiological model of thermal suitability for dengue transmission in this case. And so this model, it's a model of vectorial capacity, which is essentially a way to quantify the potential for a mosquito that's infected to transmit the virus via infective bites. But basically, we combined an empirical model of mosquito abundance with estimates of temperature trait relationships derived from laboratory experiments. So things like biting rate, survival, extrinsic incubation rate, actual development of the virus inside the mosquito. And, so this is the sort of thing that we came up with. And we can actually see some substantial variation in vectorial capacity, this thermal suitability for dengue transmission. We see it kind of higher in the middle of the city, in this case, Athens, Georgia, but we also see some patchiness, some spatial variation in these areas of high thermal suitability. And, to kind of sum that up, this is sort of the infographic. What's happening was in that urban core, even in a small city like Athens, we have higher minimum temperatures at night. And where we have patches of green in that urban core, that's actually bringing down the max temperature during the day. And so this actually creates areas where the temperature range is fairly narrow and actually remains within the optimal range for dengue transmission, which was, kind of an interesting finding. And just to wrap up a couple more slides, we're currently doing similar things, working in a couple of Indian cities where there's active malaria transmission occurring. So we have networks of microclimate loggers. You can both indoors and outdoors, so we can see seasonal variation in min and max temperature in relationship to the optimal temperatures for dengue and malaria. If we look in this case during the very hot season, in general across most of these cities, it's too hot for malaria transmission and for mosquitoes. But we actually see some cool, some of these larger green dots. These are essentially cool areas, which are potential refugia for malaria transmission during the warm season. And just to wrap it up, to point out that, in this work, we'll also be using a lot of satellite remote sensing data, both to characterize differences in different types of neighborhoods with very high resolution data, and then also track patterns of urbanization over time. And just to, just to close it out, I want to acknowledge a lot of collaborators and point out that when we do this type of work, it's often a big team-based effort where you work with a lot of interesting people. And that's it.
Thank you, Dr. Wimberly, for providing such a vast set of examples, both are all in like in terms of methods, diseases, as well as like spatial locations. So now the floor is open for questions. If you have any questions, you can put in the chat or you can unmute yourself, open the camera, just ask the questions to the panelist. Dr. Wimberly, if you want, you can stop sharing your screen.
All right. I thought I did. Oh, wait.
So I can circle back. There was one question by Gideon to Dr. Malling, and he already answered to that question. But if someone did not look into the chat, I can repeat that question. The question was, the spatial resolution of these satellite sensed data are mostly not of higher resolution. Thus, currently moving to locally sensed data are more accurate as they are of high resolution. Though access to a drone with spectral capabilities is also limited to most. Is there any new innovation in remote sensing which is bridging this gap currently?
So I think that's a good question. I'll just give a sort of a high level answer. I agree, in some cases, the resolution of the satellite data is not sufficient. You heard from Dr. Bradley of the case of looking at individual farms. You might need drones or other aircraft-based remote sensing to get the high enough spatial resolution. And at the other end of the spectrum, you heard from Dr. Wemberly how point-based measurements of meteorological conditions may not represent the wider region. So you do need satellite or other remote sensing data to help interpolate between those points. And this will sort of be on a case-by-case basis as to whether the resolution is sufficient based on your needs and what can sort of be done to address that with existing technology. I think in my response, I suggested it's possible to use satellite data as a first estimate and then use that to guide efforts to collect more location-specific data where that data will be most needed. So that was sort of my first response. I don't know if the other panelists have specific examples they want to add to that.
I could just quickly add that I feel like this issue of resolution really depends on the application. So, for example, I would argue that in many cases where we're looking at temporal variation in risk and the environmental drivers, it actually, in some cases can make more sense to look at it at a coarser scale. When we see, heat waves or droughts, those fluctuations, they tend to occur over large areas anyway. And then when you're working with epidemiological data, it actually can get incredibly noisy at fine spatial scales. So I think there are situations where, the coarser data are very practical and make sense. But as you pointed out, Carl, like in some of the urban work that we're doing, where there's a lot of very fine scale variation in land cover and, social and physical environments, we're really looking to leverage, like very high resolution commercial data to try to map and understand that variation more.
Yeah, thank you. And I hope, Gideon, that basically answers your questions. If you have anything else to follow up, you can send an email to the panelist. So there's one question by Dr. Fahime Yusufi, and it is for all the panelists. And her concern is like there's a lot of ambiguities that is associated with the disease because sometimes the environmental data is not directly associated with it, and sometimes we have limitations to the prevalence data. So how does we capture that and how we incorporate that? That's what I'm thinking because that's like a really long question. And so she asked, like, given these complexities, Is it prudent to consider integration of disease data with an examination of their relationship to environmental parameters? Or furthermore, monitoring environmental habitats and assessing the presence of disease carriers may provide a more significant, robust foundation for understanding and addressing the dynamic of infectious diseases. So what is your idea about this challenge? And it's
Can I
open to, yes.
jump in very quickly? So I saw that comment and I was all ready to jump on it anyway. So I think it's an excellent comment. And I want to emphasize that none of the disease modeling is possible without integration of medical data and the close collaboration with medical researchers and epidemiologists and in-country health professionals. So we all work with them and we work in different ways because it, as you pointed out, depends on the quality and availability of those data sets. So we find different ways to integrate the data that is available into our models. For example, mine considers parasitemia, which is reported at a certain level for the country as one of the inputs, because without knowing what the parasite load in the population is, you cannot predict the outbreaks. Mike has a more direct, for example, assessment of the number of cases than I had access to, so he has a different ability to integrate the data. I think I'm going to stop here.
I think that's a really good respond to that comment. But if Dr. Bradley or Dr. Mallings, Dr. Wimberly wants to add anything to that. Now, so we have another question from Emi Takahashi. You can ask your question.
Hi, thank you. Thanks everyone for really great presentations. My question was specifically for the epidemia project, and maybe if you could provide some more examples or discussion around the operational use or translation of the products, particularly with if I understood correctly, you're providing weekly forecasts. So I think in reality, it might be quite difficult to respond and implement actions on a weekly basis. So I was wondering if you had discussions around changing the lead times, whether it's like 1 month or 3 months beforehand to be able to kind of facilitate that operational aspect of preparedness and readiness.
Yeah, thanks. And I'll try to give a quick answer to that, and you can feel free to follow up with me if you want to talk about it more. So the model, as it's set up now, projects out to 12 weeks in the future. It was, there was a pilot implementation in the Amhara region that was supported by, it was a collaboration with a local NGO and the Regional Health Bureau and a local university. And we're also in the process of, there's currently a surveillance for malaria elimination, a broader USAID supported project throughout Ethiopia. And we're in the process of working to scale it up along with that project. So at the scale at which we make those predictions out to 12 weeks, the biggest use of those would be for logistics with various types of drugs and supplies for interventions, essentially being able to move those and deploy those with a little bit more lead time in places where there is seen to be imminent risk of a malaria outbreak. And yeah, I mean, I could go on and get into the details, but I think that's kind of at the highest level, the summary of it. And I'd be happy to follow up with you if you want more details.
Great, yeah, thank you. Maybe a follow-up would be great.
Yeah, feel free to reach out.
Can I just add something very quickly. So most of our models, for example, mine updates every 8 days, but the forecast for the outbreak indicates about 2-month lag. So 2-month prediction window.
Yeah, thank you so much. And there's one question in the chat which says how it's from Sunil Kumar, which says how accurate model can make prediction for mosquito risk with minimal number of parameters being used. In some places, there might be data scarcity. So I think it's like an open question to everyone. And I think that was a similar question that Dr. Fahime Yusufi asked. And I think
Well,
Dr. Lobot already answered that one. But yes, please, if you want to add
thank
something.
you. I'm just gonna do very, very quick answer to that. So I would say in the areas where the malaria prevalence is very high, the model that is relatively good at just providing updates on the vector is going to be sufficiently good at indicating when the outbreaks are going to occur. In the areas where the malaria prevalence is highly diminished or very low, it's not going to work at all. So it's going to really depend on the malaria landscape, essentially.
Yeah, I think that's pretty much what they asked. But yeah, if Dr. Wimberly and Dr. Bradley wants to add to it.
I would just say, I think one of the challenges that we have with remote sensing, and I kind of alluded to it with the chart from our paper at the beginning of the talk, is that we get a lot of relevant data from satellites, but often, and I see this as being different from air quality. We're not seeing the specific risk factors, directly. So there's kind of like a couple steps that we have to make. And I think that's one of the challenges. And, one of the reasons why we often use larger numbers of variables is that, we're trying to get at various pieces of this. And I mean, I kind of feel like the microclimate work that we're doing is one way to try to get to this a little bit, to say, okay, we think that understanding things like temperature and humidity at specific locations where mosquitoes and people are is important. So we're using a bunch of different data sources, but then trying to, actually get the measurement or the estimate down to, the specific risk factor.
Yeah, thank you, Doctor. And there's one more question for you, directed towards you. It said like you have in your models you have used different variables which have different importance, or I think importance associated with it. Have you ever faced like those importances has changed with time, like the correlation has changed with time from those variables, of those variables?
I think over time, it's an interesting point. And I think in general, particularly when we do statistical models, they're basically, even when we're using advanced techniques, they're still kind of crude estimation of a very complex nonlinear system. So we expect to see non-stationarity. I showed one example of that, basically spatial non-stationarity. The models make sense and are predictive in certain places, but not in others. I would think, and I think the question would reference what I would consider temporal non-stationary, the fact
Yes.
that relationships in the past may not, past performance may not give you future predictions. And that's one thing that we test for when we do validation. I have not, and one of the challenges is often our time series of data aren't quite long enough that we can try to
Exactly.
actually look at that directly. But I would say, yeah, that's probably a thing that you would expect.
Yeah. So just to remind that the last question was asked by the Mayank Gangwar. I didn't took the name of the person who asked the question. So I think, yeah, we already crossed the time. And if anyone has more questions, please feel free to reach out to the panelist and they will be happy to answer your queries. And thank you so much taking out your time, the panelists to agreeing for this webinar and everyone who attended this webinar. And we'll have another webinar in next 3 months. We'll meet again then. Thank you so much, everyone.
All right. Thank you.
Thanks. Bye.